Good afternoon everyone, I am Dr. Priya Sharma from KGMU Lucknow. I am going to present on evaluation of serum, tumor necrosis factor alpha and vascular endothelial growth factor A in primary open angle glaucoma cases. Glaucoma is one of the leading cause of irreversible blindness worldwide. It causes progressive damage to retinal ganglion cell. Cytokines mediated immune and inflammatory response play an important role in the process of glaucomatous optic atrophy. TNF alpha is a pro-inflammatory and neuroprotective cytokine. Immunological and physiological processes associated with retinal ischemia, neuronal damage, and tissue regeneration. Vascular endothelial growth factor is a 45 kilodalton glycoprotein. It is secreted by endothelial cells, smooth cells, macrophages, and tumor cells. In open-angle glaucoma patient, vascular autoregulation abnormality has been observed, which may be suggestive of hypoxic response, leading to increase in vascular endothelial growth factor. Aim and objective evaluation of serum tumor necrosis factor alpha and VEGF-A in primary open glaucoma cases. It was done in Department of Ophthalmology in collaboration with Department of Biochemistry in a tertiary care hospital. Ethical approval was taken by the Institutional Ethical Committee. Study duration was 1 year. It was an observational case control study with sample size of 44 with 22 cases and 22 controls. Inclusion criteria was patient giving voluntary written informed consent, patients of POAG in between 40 to 65 years and healthy aged matched controls. Exclusion, patient with any ocular or systemic disease which can alter retinal vasculature, patients having systemic inflammatory conditions like diabetic mellitus, hypertension, arthropathies, end-stage renal diseases, tuberculosis, malignancies. Any pregnant and lactating females and patient who participated in another study in less than 6 months. Case selection, patients who attended glaucoma clinic and the outpatient department in Department of Ophthalmology, a detailed history and ocular examination was done. Around 3 to 4 ml of blood was collected from cases and control and stored in minus 20 degree after centrifugation in Department of Biochemistry, and the ELISA technique was employed for measurement of serum levels of TNF alpha and VEGF-A. Majority of the cases enrolled in the study were males and rest females, and among controls there were more of males. And the difference between gender among cases and control was not statistically significant. Age of the subject enrolled in the study was from 40 to 65 years with a mean age of 54.77, and the mean age of control was 48.09, and this was comparable. Habitat of cases and controls were found to be comparable. This table is showing comparison between the IOP, contrast sensitivity, corneal thickness, OCT, RNFL among cases and control. Corneal thickness and OCT RNFL thickness among controls were found to be significantly higher as compared to cases. Mean serum TNF alpha was found to be significantly higher in cases compared to control, and mean VEGF-A value was slightly greater in cases and control, but this comparison was not found to be statistically significant. Mean serum alpha, TNF alpha found to be greater in severe cases compared to mild to moderate, but this relation was found to be statistically insignificant. And mean VEGF-A was also increased in cases of severe cases, but the comparison was statistically insignificant. Conclusion, there were increased levels of serum TNF alpha and VEGF-A in patients of POAG as compared to healthy controls, which indicates high systemic level of these parameters are associated with POAG. These were increased in severe cases, but their association with the severity disease was found to be statistically insignificant. So there is some possibility of some involvement of these parameters in POAG. However, their role as biomarker could not be established, and this needs further investigation. Gunham et al. In 2011 conducted a study that a total 35 patients with POAG and 30 patients with senile cataract of matched age and gender were included in the study prospectively. A positive correlation was found between TNF alpha and IL-6 in aqueous humor of POAG patient. Significant correlation was found between TNF alpha and IL-6 levels and severity of visual field loss in moderate stage. In 2019, Pantolon A et al. Conducted a cross-sectional study of 87 eyes. The level of aqueous humor in HF in patients with POAG was significantly higher than that in patients with cataract. Thank you.